Okay, so today we're going deep into neurology.
Oh, boy.
But no worries. You don't need to be a brain surgeon to follow along.
That's good.
We're going to be talking about small fiber neuropathy, or SFN.
Right, SFN.
And you've sent us some really interesting research on this.
Yeah.
So let's break it down.
Sounds good.
What is this thing?
Well, it's one of those things that can really fly under the radar.
Okay.
Even for doctors, to be honest.
Interesting.
It involves these tiny nerve fibers in your body.
Okay.
The ones that are responsible for all those subtle sensations.
Uh-huh.
You know, the ones that you don't even think about until they stop working correctly.
Yeah, like you don't really notice something until it's not working, right?
Exactly.
It's like they're kind of the unsung heroes of like our sensory system,
Yeah, I like that.
doing all the behind-the-scenes work.
Precisely. Think of your nerves like this complex communication network,
Yeah, okay.
sending messages all throughout your body.
Hmm?
These small fibers, they're like the dedicated messengers,
Okay.
responsible for all that information about temperature pain,
Yeah.
even light touches,
Okay.
all those subtle things,
Wow.
all those things you don't think about until they're gone.
Yeah, that makes sense.
Hopefully they don't.
Well, this research paper that we have here,
Yeah.
it explains how when these small fibers get damaged, it can lead to a whole cascade of problems.
Yeah, it can spiral.
Yeah, it mentions things like burning and tingling, even issues with digestion and bladder control.
It's a big deal.
It really is.
And that's one of the big things that makes SFN so challenging.
Okay.
The symptoms can be all over the place,
Really varied.
and they can be mistaken for so many other conditions.
Wow.
Plus, they often develop gradually,
Okay.
so people might just brush them off at first.
Yeah, like, oh, it's probably nothing.
Exactly.
Damn, that's tough.
And then it just gets worse.
The article mentions pins and needles.
Mm-hmm.
It makes it sound almost pleasant, but then it talks about severe chronic pain,
Right.
difficulty sleeping, things that are definitely not pleasant.
No, not at all.
It also talks about a glove and stocking distribution of symptoms.
Oh, right. What is that all about?
So that's like the classic presentation of SFN.
Okay.
It means that the symptoms usually pop up in the hands and feet first,
Okay.
almost like you're wearing gloves and stockings.
I see.
However, and this is where it gets a little tricky,
Okay.
SFN can also affect people in patches. Interesting.
Which makes it even harder to pin down.
Oh, wow.
Not always so clear-cut.
So speaking of diagnosis,
Right.
this research paper really dives into the challenges that doctors face when they're trying to identify SFN.
Yeah, it's not easy.
It says that routine neurological exams often miss it
Often, yeah.
because they're focused on the larger nerve fibers.
Right, the big guys.
So if these small fibers are the culprits, how do doctors even begin to unravel this mystery?
Good question.
It's like they need to be medical detectives,
You got it. That's a great way to put it.
putting on their Sherlock Holmes hats.
They got to do a deep dive.
So what are their tools? What are they looking at?
Well, this study really emphasizes the importance of a thorough medical history.
Okay.
Doctors need to really listen to their patients.
So it's not just a quick in and out appointment,
No, it's really about listening and understanding what the patient's experiencing.
taking the time.
Exactly, because those little details can make all the difference.
So it's more than just a quick reflex check with a hammer.
Right. You need more than just a hammer for this one.
So what else? What else are they doing?
Well, this paper also highlights the importance of some specialized tests.
Okay, like what?
Things like skin biopsies, which might sound a little surprising.
A skin biopsy for nerves.
Yeah, it's not the first thing you think of.
What else?
They've also got things like nerve conduction studies
Okay.
and even sweat tests.
Hold on. Sweat tests.
Yeah,
You mean they can diagnose nerve problems through sweat?
that's right.
That is fascinating.
It's pretty cool how they figure that out.
Tell me more about that. How does that work?
Well, remember how we talked about those small fibers being involved in your body's automatic functions?
Yes.
Sweating's one of them.
Okay.
A sweat test measures how your body sweats in response to certain things.
Okay.
And if those nerves are damaged, it'll show up in the results.
So they're looking for like inconsistencies or something?
Yeah, exactly. They're looking for patterns that are off.
Wow, that's incredible.
It's like a whole other language.
It is. It's like our bodies hold the clues,
Yeah,
and doctors just need the right tools to kind of decipher them.
exactly like a detective novel.
But let's talk about the root of the problem here.
Okay.
What causes these tiny fibers to go haywire in the first place?
Ah, the million-dollar question.
Yeah.
And unfortunately, there isn't always a straightforward answer.
So it's not as simple as just saying, oh, you have SFN because of this one thing.
Unfortunately not. It's usually way more complicated than that.
Oh, man.
This research points to a whole bunch of potential culprits.
Okay, like what?
Well, you've got things like diabetes,
Yeah.
vitamin deficiencies,
Okay.
autoimmune diseases,
Uh-huh.
even just being exposed to certain toxins in your environment.
So it could be our lifestyle choices catching up to us,
It could be.
or something we're exposed to in our environment,
Absolutely.
or even a combination of factors.
It's often a perfect storm of things.
Oh, boy.
And sometimes, even after all that investigation, the cause remains a mystery.
Really?
Yeah, and that's what doctors call idiopathic, SFN.
Okay, so what does that mean in plain English?
Basically, it means they haven't been able to pinpoint the exact cause of the nerve damage.
So it's a big question mark.
Exactly.
Wow, and that's got to be frustrating for everybody involved.
Oh, it definitely is. It can be really tough for both patients and doctors.
Because you want answers.
Oh, of course.
But it doesn't mean that there's no hope, right?
Exactly. There are still ways to manage the condition, even if we don't know the exact root cause.
That's good to hear.
We just have to get creative sometimes.
So that makes sense. But let's say they do pinpoint the cause.
All right.
Is treating that enough to kind of resolve the neuropathy?
Okay.
Or is that a whole other battle?
Well, ideally, addressing the underlying cause is the most effective way to manage SFN.
Okay.
However, it's not always a quick fix.
Okay.
Sometimes the nerve damage is already done.
So it's like the damage is done.
And in those cases, the focus shifts to alleviating those often debilitating symptoms.
And that's where things get even more complicated, right?
Yeah, it can get pretty tricky.
Because this research paper dives into some of the treatment options.
Yeah.
And it doesn't seem like there's like a one-size-fits-all situation here.
Yeah, no magic bullet, unfortunately.
They mention medications, lifestyle changes,
It's all connected.
even alternative therapies.
Lots of different avenues to explore.
So where do we even begin?
Well, let's start by unpacking some of those treatment options in a bit more detail.
Okay, let's do it. Okay, so we're talking about managing those symptoms.
Right, because sometimes the damage is already done.
Yeah, and those symptoms can be really debilitating.
They can be really tough to live with.
This research paper mentions medications, things like pain relievers,
Yeah.
usual suspects,
No!
even drugs that are typically used to treat epilepsy.
It's true.
That seems like a pretty wide range of options.
It is, and it just goes to show you how complex this whole thing can be.
Okay.
Treatment isn't always straightforward.
So what are doctors looking at when they're trying to decide what to do?
Well, they really have to consider the individual patient.
Okay.
How bad are their symptoms?
Okay.
What other health conditions are they dealing with?
Right, because everything's connected.
Exactly. It's all connected.
So walk me through this.
Okay.
Let's say someone is dealing with chronic pain from SFN.
Mm-hmm.
What are some of the options that their doctor might consider?
So in a lot of cases, the first line of defense is going to be those over-the-counter pain relievers.
Okay, like what? What are we talking about?
Think ibuprofen or acetaminophen.
Okay, the stuff that you can get at the drugstore.
Exactly. But for more severe pain, a doctor might have to go with something stronger.
Okay, like what?
Things like opioids. But those come with a whole other set of risks and benefits.
Right, those can be addictive.
Exactly. So it's a delicate balance.
This study suggests that antidepressants are sometimes used to manage SFN pain.
Yeah, that's right.
That seems a little counterintuitive.
I can see why you'd think that.
Don't antidepressants affect mood, not pain?
So that's actually a pretty common misconception.
Oh, really?
Yeah, you see certain types of antidepressants,
Okay.
particularly the ones that increase serotonin and norepinephrine levels in the brain.
Okay.
They can actually interfere with pain signals in the nervous system.
Interesting.
So that means they can provide some pain relief,
Oh.
even for people who aren't dealing with depression.
So it's not about masking the pain with like a mood boost or something?
No, not at all.
It's actually targeting those pain pathways directly.
Exactly.
Wow, that's fascinating.
That's like cutting off the pain signal at the source
Okay.
before it even reaches the brain.
So then what about the anticonvulsants that the paper mentioned?
Oh, right, the anti-seizure medications.
Yeah, I'm trying to wrap my head around that one.
Yeah, it does seem a little strange at first.
Anti-seizure meds for nerve pain.
I know, but it actually makes a lot of sense when you think about it.
Okay, how so?
Well, some anticonvulsants work by basically calming down overactive nerves.
Okay.
And that can be really helpful in reducing those burning and tingling sensations that people with SFN experience.
So it's about kind of calming those nerves down. Okay, so we've talked about medications. What about those lifestyle changes that the research mentioned?
Right, because those are just as important.
It seems like taking care of our overall health is crucial here.
Absolutely. It's all connected. Remember,
Right.
the article really stresses the importance of managing any underlying conditions.
Okay, like what? Give me an example.
So let's say diabetes is the culprit.
Okay.
getting those blood sugar levels under control becomes super important.
Makes sense.
And not just for the neuropathy, but for overall health in general.
Right. It's like taking care of the root of the problem.
Exactly. You want to address the root cause whenever possible.
So it's not just about masking the symptoms, it's about really getting to the bottom of things.
That's the goal.
And what about things like exercise and diet?
Those are huge.
How do those factor into the equation?
Well, for starters, exercise helps improve blood flow.
Oh,
And that's essential for delivering oxygen and nutrients to those nerves.
it's like giving your nerves the nourishment they need.
Precisely. And then you've got diet,
Okay.
eating a balanced diet that's rich in fruits and veggies.
Right, all the good stuff.
Exactly.
Low grains.
All of that provides the building blocks for healthy nerves.
So it's about supporting our bodies from the inside out.
Exactly.
Making sure those nerves have what they need to function properly.
You got it.
So we've covered medications, we've talked about lifestyle changes.
Right.
The article also touches on some alternative therapies.
Yes, it does.
Things like acupuncture and meditation for pain management.
Interesting options for sure.
Yeah, and that's one area where I wanted to dig a little deeper.
Okay, sounds good.
What's the science behind these therapies?
That's where things get a little tricky.
Okay.
While some people report finding relief from these types of therapies,
Okay,
the scientific evidence is still a bit limited.
so we don't have all the answers yet.
Not yet, but research is ongoing.
So it's not like a magic cure or anything.
Right.
But it might be something worth exploring for some people.
It could be, but it's important to approach any alternative therapy with a healthy dose of skepticism
Okay,
and always talk to your doctor
right.
before making any major changes to your treatment plan.
So it sounds like managing SFN is not a one-size-fits-all approach.
Definitely not.
It's about working closely with your doctor, figuring out what works best for you.
Finding the right combination of things.
This study really emphasizes that early diagnosis and treatment are key
They are absolutely crucial.
when it comes to preventing further nerve damage and improving outcomes.
It can make all the difference.
Why is that? Why is early detection so important?
Well, the longer SFN goes undiagnosed and untreated,
Yeah.
the greater the risk of permanent nerve damage.
So it's like a race against time almost.
In a way, it is.
So what would you say to someone who's listening to this right now and they're thinking, hey, some of this sounds a little too familiar.
Right.
Maybe I should get checked out.
I'd say definitely get it checked out.
What's the first step?
Well, if you're experiencing any of the symptoms we've talked about,
Yeah,
don't ignore them.
right.
Don't downplay them.
Advocate for yourself.
Yeah.
Talk to your doctor. Okay. And be honest about what you're feeling.
So a primary care physician is a good place to start.
Absolutely. They can assess the situation
Okay.
and then refer you to a specialist if necessary.
And in this case, who would that specialist be?
So for SFN, you'd probably want to see a neurologist.
Okay, a nerve doc.
Exactly. They're the experts when it comes to the nervous system.
This deep dive has been incredibly informative.
It's been great talking about all this, but it's also highlighted just how much we still don't know about SFN.
Oh, there's still so much to learn.
It's like the more we learn, the more we realize how much more there is to discover.
That's what makes it so fascinating.
It really is. And speaking of fascinating,
Okay.
we have this Spanish medical review here
Yeah.
that dives into the different types of small fibers. Okay.
And how they're affected in different conditions.
Interesting.
What are some of the key takeaways from this review?
Well, one of the things that really stood out to me was that it's not just one thing. You know,
Right.
when we say small fiber neuropathy,
Right.
it's really more of an umbrella term.
Okay.
You've got a whole range of nerve disorders under that umbrella.
So there are different flavors of SFN, so to speak,
Exactly.
depending on which small fibers are affected.
That's right.
So what does that mean for diagnosis and treatment?
Well, it means that each case is like a puzzle.
Okay.
Doctors really have to consider all the pieces.
Right. Like, what are they looking at?
Well, they're looking at the patient's medical history, of course.
Right.
They're considering their specific symptoms.
And then those test results, those specialized tests we talked about earlier.
Right. To get the full picture.
Exactly. They've got to put it all together.
It makes you appreciate the complexity of the human body
It really does.
and how something as small as damage to these tiny fibers
Mm-hmm.
can have such a huge impact on someone's life.
And it's not just physical either.
Right, because we're talking about the emotional and social aspects as well.
Exactly. This review really emphasizes that
Yeah.
the emotional and social toll that SFN can take is often overlooked.
Yeah, because it's easy to focus on the physical symptoms.
Right. But imagine dealing with chronic pain, tingling, numbness,
Day in and day out.
It affects everything.
Yeah, it's gotta.
Work, hobbies, relationships.
It really does impact your whole life.
It impacts your whole life.
So it's not just treating the physical symptoms, it's about treating the whole person.
Absolutely. A holistic approach is key.
I like that.
That's what this study emphasizes.
One final point this review touches on is the role of genetics in SFN.
Okay, genetics?
It seems like in some cases there might be a hereditary component.
Right. That's something that's being explored more and more.
So what do we know about that so far?
Honestly, we still need more research in that area,
Okay.
but it's definitely something to keep in mind.
Okay.
If you have a family history of SFN, or really any other nerve disorders, it's worth bringing it up with your doctor.
Just to be on the safe side.
Exactly. You know, knowledge is power.
Absolutely.
The more we understand about this condition,
Yeah.
the better equipped we are to manage it effectively.
This has been a really insightful deep dive.
It has.
We've learned so much about the causes, the diagnosis, the treatment, even the genetics of SFN.
We really covered it all.
And it's clear that while it presents some pretty big challenges, there's also a lot of hope.
Absolutely.
Research is advancing, awareness is growing, and new treatments are on the horizon.
Always looking for new solutions.
That's a great point to end on.
Yeah.
For those listening who are dealing with SFN, you're not alone.
That's right. There are resources available,
And research is ongoing.
paving the way for a brighter future.
We've covered so much in this deep dive.
We really have.
All about small fiber neuropathy, from those microscopic nerve fibers to the very real impact it has on people's lives.
It's a big deal.
But one question that I'm left with is this potential link between SFN and fibromyalgia.
Interesting.
They both involve chronic pain, often really baffling symptoms.
It's true. They can be tough to pin down.
Could there be a common thread there?
No, that's a question worth exploring.
It is, and that's something to ponder.
Definitely something to think about.
As you delve further into the world of neurology,
Until next time.
keep those questions coming.